She's just a nurse. That's what Dr. Marcus Mercer whispered to the resident trailing behind him on rounds, his voice pitched low enough that Laura Bennett wouldn't hear it from the medication cart where she was documenting a post-op pain assessment. Just a nurse. 2-year community college program. No research credentials. No publications. No pedigree. He said it the way other men said cockroach, like something small and inevitable that kept appearing no matter how many times you tried to eliminate it. Laura didn't look up from her tablet. Her hands kept moving, steady, practiced, recording vitals with the kind of precision that came from holding broken people together in places where there was no backup, no second opinion, no time to second-guess yourself. But she heard him. She always heard him. 3 years at Cedar Creek Medical in Denver, and Dr. Marcus Mercer had made it his personal mission to remind her of the gap between his credential-laden office wall and whatever qualified as her professional foundation. The thing Mercer didn't see, had never seen, would never see, was that Laura's hands moved like a surgical laser when she rapped for lines, one-handed threading that should have required two. He didn't see the micro-adjustment she made to ventilator settings based on a patient's breathing pattern before the monitor registered any change. He didn't see the way she read a room the moment she entered it, calculating risk vectors the way a tactical officer reads terrain. Command authority disguised as bedside manner. 18 years of experience wearing a community college diploma like a disguise. The faded unit patch was sewn inside her jacket lining, hidden in the darkness where only she would ever touch it. Navy. One word embroidered in thread that had faded almost to white. Captain Laura Bennett, that name, that rank, that identity, had been erased from every military database the Pentagon could access. The Black Ops disaster in Baghdad had consequences. Protocols existed. Sacrifice was classified. So she'd become just Laura, just a nurse, just someone who moved through Cedar Creek Medical's fluorescent-lit hallways trying to be invisible in the way that only people who'd once been essential understood how to do. Her left forearm carried a scar the length of her index finger, thick tissue that caught on scrub fabric when she reached for medications. Blast shrapnel. She'd received field surgery for it in a forward operating base north of Fallujah. The surgeon, a captain like her, maybe 26 years old, hands trembling slightly despite his expertise, had told her to stay still, that the tremor was just adrenaline. She'd stayed still. She always stayed still. The tremor was information. Pain was data. You didn't react to data. You processed it. The smell of antiseptic and floor wax hung in the Cedar Creek pediatric ward like a persistent ghost. Cold stainless steel bed rails caught the morning light filtering through windows that never opened. Laura moved down the corridor to wardroom for 12, her navy scrubs brushing against the fabric of her jacket, the one with the hidden patch inside the lining. She checked her phone reflexively, a habit from when that phone used to have a classified Pentagon direct line, when calls came at 0300 hours with coordinates and casualty counts. Now her phone was just a phone. Work schedule reminders. Her daughter's soccer practice. Nothing classified. Nothing that mattered to anyone except the people she kept alive one shift at a time. Dr. Marcus Mercer arrived on rounds at 0800 hours sharp, which meant 0755 because punctuality was another form of control. His Italian leather shoes clicked against the tile floor with the precision of a metronome. Click, click, click. The sound of institutional authority. He was tall the way men who'd never done physical labor stayed tall, posture maintained by tailors and the certainty that his body would never have to move faster than a comfortable walk. His hair was the precise shade of silver gray that came from expensive coloring at a salon that didn't have a waiting room. Behind him followed 2 residents in white coats, junior doctors, fresh enough that they still looked slightly lost, the way people always did when they were learning to be gods. Laura documented a patient's morning assessment from the medication cart, her presence so deliberately small that Mercer walked past without seeing her, which was exactly how she preferred it. But the residents noticed her. They always did. The female residents especially. Something about the way she moved, the quiet competence, the suggestion that she knew something about survival they hadn't learned in their textbooks yet. "Gentlemen," Mercer said to his residents as he pushed into room for 12, "observe how clinical excellence requires a foundation in rigorous academic training. Theory. Research. Institutional rigor. This is what separates actual medicine from well-intentioned guessing." He gestured toward the patient chart on the monitor. 80-year-old male. Post-op day 3 from hip replacement. Routine recovery. Nothing complicated. Nothing that required Mercer's presence, but presence was itself a form of control. Laura watched from the hallway, pretending to update the chart on another patient, while actually tracking how the resident on the left, a woman named Chen, was performing a neurovascular assessment on the post-op patient's foot. Chen's hands were too slow, her touch too tentative. She was checking pulses like she was afraid the patient would break. Mercer observed this without correcting it, which meant he was collecting evidence of failure to catalogue later. When Laura finished her own patient assessment on room for 16, she moved into room for 12 and gestured to Chen with her eyes. Not a word. Just a look that said step aside. Chen hesitated, glancing at Mercer, waiting for permission from the hierarchy to move. Mercer was watching something on his phone, the gesture casual but the message clear. He was not giving permission. He was not giving anything. Laura waited exactly 3 seconds, then moved around Chen with the kind of deliberate smoothness that suggested she wasn't aware she was doing it. Her hands found the post-op patient's foot. 2 fingers on the dorsalis pedis pulse, 2 on the posterior tibial. Quick assessment of quality, rate, symmetry. Pulse is strong and equal, she said to no one in particular, documenting on the chart. Good capillary refill. You're healing perfectly. She said the last part directly to the patient, making eye contact for the first time since entering the room. The patient visibly relaxed. That was the thing Mercer would never understand. That a patient who felt seen, who felt like their experience was being acknowledged by someone who actually cared about their body beyond the academic exercise of it, healed faster. Recovery rates reflected this. Laura's patients had significantly fewer post-op complications than the hospital average. This was documented. This was measurable. This was also, to Mercer, an embarrassment, because it suggested that something beyond credentials mattered, and credentials were the only thing Mercer had ever trusted. Observation complete, Mercer said as they moved into the corridor, his voice carrying just far enough that Laura could hear it. Nursing staff can perform basic assessments if proper supervision prevents them from overstepping their scope. The key is maintaining the hierarchy. Some people understand their place in the chain of command. Others require consistent correction. One of the residents coughed, which might have been genuine or might have been an attempt to mask something that sounded like disagreement. Laura didn't react. Reacting gave Mercer material. Reacting was showing him that his words had penetrated her carefully constructed invisibility. She finished updating the chart, her handwriting precise as a military log entry, each character exactly the same size and slant. But she could feel the weight of something shifting. The weather forecast had predicted a system moving into Denver from the southwest. Rain expected by afternoon. Lightning probability elevated. The kind of atmospheric pressure change that made old injuries ache, that made people in hospitals feel it in their bones before it arrived. And that afternoon, the first truly serious case would walk through Cedar Creek Medical's emergency department, and everything, the routine, the hierarchy, the careful distance Laura had maintained for 3 years, would shatter. The fluorescent lights above the pediatric ward buzzed with their characteristic electric hum, the sound like insects trapped in the ceiling. Laura moved through her shift with the ease of someone who'd learned not to be noticed, who'd learned that visibility was dangerous, that the safest thing was to be essential without being seen. She touched the faded unit patch through her jacket lining during her lunch break in the staff lounge, a gesture so automatic she barely registered it. A talisman. A reminder of who she'd been. A promise to a version of herself that no longer existed in any official capacity. The patch was navy. The memory was older. And in exactly 4 hours, a 10-year-old boy named Dylan Garrett would arrive by ambulance after a diving accident that would change everything, not just for him, but for Laura Bennett, who'd spent 3 years learning how to be invisible but was about to discover that invisibility only works until the moment someone needs you to be absolutely, unforgettably visible. The ambulance bay doors burst open at 2:56 p.m. on a Thursday, and the stretcher rolled through like a ship into fog. 10-year-old Dylan Garrett lay motionless beneath the shock blanket, his small frame utterly still except for the involuntary flutter of machines keeping him alive. His father, Lieutenant Commander James Garrett, moved beside the stretcher with the careful precision of a man trained to remain functional in catastrophe, one hand touching his son's shoulder as if contact alone could reverse what the diving board had done. Laura watched from the nurse's station as they wheeled him into Trauma Bay 3. She didn't move toward him. Not yet. The ER belonged to the doctors in that first golden hour, and she'd learned long ago that some protocols existed for reasons that had nothing to do with medicine and everything to do with hierarchy. But her eye stayed on the boy's toes. Small, pale, utterly still. She made a mental note: no visible response to the cold exposure of transfer, no reactive movement during the shouting. The diving accident had crushed something between T10 and T12 on his spine, a compression fracture with cord involvement, the CT scans printed and mounted and already being passed between attending physicians like evidence at a trial. By Friday afternoon, 15 different doctors had examined Dylan Garrett. 15. They came in waves: orthopedic surgeons with expensive watches, neurologists with the kind of certainty that only comes from having read the same literature for 23 years, 2 spinal specialists from the university hospital who consulted via video and shook their heads with synchronized regret. Dr. Marcus Mercer was among them, of course. He spent 43 minutes in the room on Friday morning, methodically testing reflexes with the poise of someone conducting a post-mortem. When he emerged, he signed the notes in that angular handwriting of his: spinal cord transection, T10, T11 level. Prognosis: permanent paraplegia. Recommend palliative pathway and early psychiatric consultation for family adjustment. The verdict was unanimous. The damage was permanent. The boy would never walk again. Laura's overnight shift began at 11 p.m. Friday. She was assigned to the ICU recovery section, and Dylan's room was the 4th door on the left, the machines around his bed arranged like witnesses to a foregone conclusion. She did the standard checks: vitals, catheter output, neurological assessment using the standardized scale that reduced a human nervous system to numbers on a chart. At 2:14 a.m., during her final rounds before the shift change, she stood at the foot of his bed performing what every nurse performs every shift: a basic sensory and motor exam, the ritual motion of touching his feet, checking for any response. The toes on his right foot moved. Not a full contraction. Not even something a colleague might notice if they were tired or distracted. But a micro-movement, a slight flexion of the 3rd and 4th digits, the kind of involuntary response that 15 doctors had already dismissed as primitive reflex arc, the body's automatic protest against stimulus. Laura had seen the dismissal in their notes. Primitive. Meaningless. Evidence of nothing. She touched his toes again. Same response. Slow. Subtle. Present. She documented it in his chart with clinical precision: 2:15 a.m., dorsiflexion noted in right foot, digits 3 to 4, sustained for approximately 1.2 seconds in response to tactile stimulus. Likely reflex arc, but documented for continuity. She didn't write what she was thinking. Nurses who wrote what they were thinking about doctors' opinions didn't keep their jobs long, and she'd already spent 3 years learning how to be invisible. The unit patch in her jacket lining would stay hidden. The instincts that had kept soldiers alive in the Jolin district would stay quiet. She observed the movement again at 3:40 a.m. and 4:08 a.m. Each time she documented it. Each time it was there. Each time she said nothing to anyone. Thursday morning arrived wrapped in the fluorescent hum of Cedar Creek's Grand Rounds, the weekly amphitheater-style presentation where the hospital's physicians and residents gathered to discuss cases, challenge diagnostic reasoning, and reinforce the hierarchy of who knew what and whose opinion carried weight. Laura was not supposed to be there. The ICU nurses who attended Grand Rounds were the nursing supervisors and the residents who'd been selected for advancement tracks. But Dylan Garrett's case was being presented, and she had volunteered to retrieve his chart from medical records. No one had said she couldn't stay in the back of the room. She stood near the doors in her scrubs, anonymous among the crowd of white coats. Dylan's case was the 7th presentation. A resident presented the imaging, the clinical history, the 15-physician consensus. The room was silent except for the resident's voice and the electrical whisper of overhead projectors. Mercer sat in the 3rd row, that specific posture of his, spine against the chair back, hands folded across his lap with the kind of perfect stillness that came from someone who never questioned his own assumptions. Then the resident said, "The family is requesting a second opinion regarding potential neurological recovery." The room shifted. Someone exhaled through their nose. Mercer's hands tightened. "The request is being driven," the resident continued, "by documentation of what might be involuntary motor response in the lower extremities." That was when Mercer stood. He moved with a kind of theatrical precision that required an audience, and he walked to the presentation table and took the chart from the resident's hands. Not requested. Took. The movement was smooth enough that it almost looked like assistance, but the resident stepped back anyway, as people do when they've been superseded. Mercer held the chart up so the room could see it. 50 physicians and residents watched him, and the room had that particular quality of silence that comes when everyone senses something is about to happen. "Exhibit A," Mercer said, his voice carrying the texture of polished contempt, of dangerous optimism from undertrained staff. He let the chart hang in the air for 3 full seconds. "Nurse Bennett here believes she has discovered what 15 board-certified neurologists, specialists in spinal cord injury, have somehow missed. Motor response." He said the words the way someone might say evidence of witchcraft. "She has documented involuntary reflexes and apparently hopes we will mistake them for recovery. This is precisely the kind of thinking that gives families false hope and leads to unnecessary complications in their adjustment process." Laura felt the weight of 50 pairs of eyes in the room suddenly become aware that there was a nurse present. 50 pairs of eyes that had not seen her before. She stood against the back wall in her scrubs and did not move. Did not flinch. The trembling was not fear. It was restraint. "The spinal cord is transected," Mercer continued, and now he was pacing, and now his voice had the particular rhythm of someone who was enjoying himself. "Transected. There is no pathway for motor command. What we are seeing here are primitive reflexes, the kind of response you see in a decapitated frog. Meaningless. But this is what happens when nurses start practicing neurology." The laughter came from 3 different physicians in the room. Not unkind laughter. Institutional laughter. The kind of sound that reinforces where people belong. Mercer turned, as if on cue, toward the back of the room where Laura was standing. His eyes found her with the accuracy of a man who'd been waiting for this moment. "Nurse Bennett, do you have something you'd like to add?" The room was perfectly quiet now. The kind of silence where the fluorescent lights hummed like a confession. Laura stepped forward. 2 steps. She was moving into the space between the chairs, into the sight line of every physician present. Her voice, when it came, was steady and low, the voice of someone speaking from experience rather than from fear. "The micro-movements documented in the chart," she said, keeping her eyes on Mercer, "correlate with the dermatomal distribution of T12 dermatome. The pattern is not random primitive reflex. It's localized. It's responsive to specific tactile input. And if the spinal cord transection is incomplete, if there's even a single intact nerve fiber pathway, then—" "Nurse Bennett," Mercer interrupted, and his smile was the smile of someone holding the superior position, which he was. "Your job is to empty bedpans, not play doctor. Maybe security should escort you back to basics where you belong." The room went absolutely still. The kind of silence where you could hear the rain beginning outside, drumming against the hospital windows like applause from a crowd with no face. Laura did not look away. She fixed him with a stare cold enough to frost glass, and in that moment something happened in her posture, something shifted in the way she was standing. The invisible nurse became suddenly and completely present, and Mercer saw it happen, and something flickered across his face, not fear, but recognition, the way a predator recognizes another predator dressed in different skin. She waited 3 full seconds. Then she said, her voice dropping an octave, steady as a surgical laser, "I've held more lives in my hands than you've held scalpels, Doctor." She turned and walked out of the amphitheater while he stood motionless, the chart still hanging in his hands. The doors closed behind her with a soft pneumatic hiss. Mercer's mouth opened and closed, and for a moment he was utterly defenseless, utterly exposed. That was the moment the room understood something was different about the woman who'd just walked out. That was the moment Dr. Marcus Mercer understood it too, though he would spend the next 72 hours trying to convince himself he was wrong. By the vending machines at 3 p.m. that same day, a resident named Dr. Sarah Chen, one of the good ones, one of the ones who actually asked patients their names, found Laura restocking 4 kits. "For what it's worth," Chen said quietly, feeding coins into the machine, "half the room was thinking what you said. He's been calling you a community college to the attendings. Said you probably got your nursing degree from some online program." Chen took her coffee and hesitated. "Whatever happens, he started this. You should know that." Laura acknowledged this with a slight nod and said nothing. Saying nothing was still her best strategy. The unit patch remained hidden. The muscle memory for commanding a room would stay locked away. But that evening, during evening rounds, she found Lieutenant Commander James Garrett sitting beside Dylan's bed, reading from a worn book, some military history thing with a cracked spine. He looked up when she entered, and there was something in his expression, something that suggested he'd heard something about the Grand Rounds incident, or maybe he was simply a man learning to recognize the difference between people who were kind to his son and people who had given up on him. "He's been talking about Captain Vaylor," James said. The words came out carefully, like he was testing their weight. "Says his dad talks about her all the time. The captain who saved his entire squad in Baghdad." Laura's hand stilled on the 4 pump. Baghdad. The name conjured images she'd spent 3 years trying to bury: dust storms, the smell of diesel and blood, the weight of making decisions that meant men lived or men died. Captain Vaylor. The call sign she'd been given by the unit, the name whispered in the reports that were filed and then erased, the classified designation that was supposed to stay classified. "That's a good story," she said finally, her voice light, her hand steady. "A lot of soldiers have Captain Vaylor stories." "Not like his," James said. He was watching her carefully now, the way a man watches someone and realizes he's seeing them for the first time. "He says she wasn't like other officers. She knew medicine. Field medicine. Ran an operation once with a combat knife and the contents of an MRE pack that saved for guys who shouldn't have made it." Laura finished the forecheck and made a note in the chart. Her handwriting was steady. Everything about her was steady. But inside, something that had been locked for 3 years was beginning to rattle against its cage. The next morning, Laura arrived at Cedar Creek Medical at 5:47 a.m., before the day's shift briefing, before Mercer made his rounds, before the noise of a hospital fully woke. Dylan's room was dim, monitors casting pale green light across his small frame. She moved without announcing herself, muscle memory from field medicine taking over, no wasted motion, no sound. Just observation. His feet. She focused only on his feet. She documented the toe movements in her notes: 2 millimeters of dorsiflexion on the right, a barely perceptible inversion on the left. The other 15 doctors had called them spinal reflexes, involuntary nerve firing below the level of injury, meaningless as wind moving a flag. But Laura had held paralyzed soldiers in Baghdad while shrapnel whistled overhead, and she knew the difference between a nerve that was dead and a nerve that was sleeping. Over the next 6 days, between medication rounds and charting, she performed gentle range-of-motion work on Dylan's lower extremities during her personal time. 10 minutes here. 15 minutes there. Never recorded. Never announced. She moved his ankles through slow arcs, plantar flexion, dorsiflexion, inversion, eversion, supporting each movement with her palms as if conducting an orchestra only she could hear. The boy's eyes would flutter open sometimes, watching her with the focused attention of a child who understood that something important was happening to his body, even if the doctors said nothing could. "Does it hurt?" she asked him on Wednesday. "No," Dylan whispered. "But I feel it. In my leg. Like, far away. Like someone's touching me in a dream. Sensation returning. Proprioception intact. The neural pathway wasn't severed, it was swollen, compressed, dormant. Everything about the clinical picture pointed to incomplete spinal injury, not the permanent cord transaction 15 doctors had agreed upon. Laura documented everything. Meticulous notation. Date. Time. Movement amplitude. Response to stimulation. She filled pages with observations the official medical record would never see, tucking her private notes into the pocket of her scrubs. This was how she'd tracked casualty responses in combat zones, keeping parallel records, because sometimes the official channels didn't survive the chaos of reality. It was Thursday afternoon, 2 hours before end of shift, when she was helping Dylan with a sip of water that he said it. "My dad told me about Captain Vela," the boy said, his voice small and factual. "He was in Baghdad. He saved a lot of soldiers." Dylan looked at her directly. "My dad says she was the bravest person he ever knew." The water cup stopped halfway to his lips. Laura's hand didn't shake. Her breathing didn't change. But something beneath her ribs, something that had been locked in a safe for 3 years and 4 months, pressed against the cage. "That's a good thing to remember about someone," she said quietly. "Do you think you'd know if you met her?" Dylan asked. "Like, would you just know?" Laura set the cup down. She straightened Dylan's blanket with the same precision she'd once used to inspect a rifle. "Yes," she said. "I think the person would know. That's what would matter." She left the room before Dylan could ask anything else. But James Garrett had been waiting in the hallway. She'd never seen his face in civilian clothes, only in military bearing, in body armor, in the split-second flash of recognition before a convoy rolled out across Ramadi's industrial district. He was thinner than she remembered. Civilian clothes hung on him like he was still waiting for his body to remember how to fill a life that wasn't operational. His eyes went wide, then narrowed, then filled with a recognition so complete it was like a man remembering his own breathing. "Captain," he said. Not a question. A statement of fact. "Mr. Garrett." She kept her voice level, professional, the voice of a nurse acknowledging a family member in a hospital hallway. She continued walking. He followed, maintaining 2 steps behind, the spacing of someone trained to follow orders. "How much?" he started. "Your son shows signs of incomplete spinal injury," Laura said, not turning. "Micro-movements, proprioceptive response. Sensation returning. The prognosis they gave you was conservative. I believe they were wrong." She reached the medication cart and began checking names against files. Her hands were steady. The tremor was gone. "Captain, I'm his nurse, Mr. Garrett. That's what matters. I'll do my job." She loaded 3 syringes into her pocket. "Dylan doesn't know who I am. He doesn't need to. He needs to recover." James Garrett understood. 20 years of military service had taught him when to press and when to stand down. He nodded once. "Whatever you need," he said quietly. What she needed was access. What she needed was time. What she got instead was Dr. Marcus Mercer, who arrived at Cedar Creek Medical at 8 a.m. the following Monday with a memo in his hand and a smile that smelled like ambition. The memo was brief, effective immediately. The pediatric physical therapy team would be reassigned. A new attending would manage Dylan Garrett's rehabilitation protocols. Dr. Mercer himself would oversee all PT sessions, all documentation, all movement protocols. Laura's role would be limited to vital sign monitoring and basic nursing care. No participation in therapy sessions. No input on rehabilitation parameters. No deviation from approved protocols, which, the memo noted pointedly, would be conservative and evidence-based. She read it twice in the staff break room. The second reading didn't change the words. "Welcome to the department politics show," said Marcus Chen, one of the night shift nurses, sliding into the chair beside her. Mercer doesn't like to be challenged. You challenged him. Now he's making sure you can't do it again. Laura folded the memo precisely and placed it in her pocket. I see. Do you? Marcus leaned closer, lowering his voice. Because I'm looking at someone who looks real calm for a person who just got benched. That's either professional composure or you've got something figured out that the rest of us don't. She didn't answer. Some things weren't safe to say out loud. Mercer's restrictions were elegant in their construction, hospital policy, not personal vendetta. Therapy sessions would be scheduled during her breaks or outside her shift hours. Physical therapy notes would be filed by the PT team directly, not through nursing documentation. Laura's patient contact would be limited to the 2-hour nursing shift from 3 to 5 p.m. after all formal therapy work concluded. By policy. By protocol. By the careful architecture of someone who knew how to use institutional structure like a weapon. But restrictions had gaps if you knew where to look for them. The hospital's security system operated on motion sensors in main corridors but relied on manual checkout procedures in patient rooms. A nurse could access a room legitimately to check vitals, and once inside, no record would note exactly how long she stayed. The PT department's notes were filed electronically, but handwritten supplemental observations by nursing staff were scanned into the system without prior review, just timestamp verification. The gaps were small. Almost invisible. Exactly the size of a woman who'd learned to move through conflict zones without being noticed. For 3 days, Laura worked around Mercer's architecture. She performed the range of motion work in Dylan's room during the official 3 to 5 nursing window, but she documented nothing. No new notes. No progress reports. Just vital signs, heart rate, respiratory rate, blood pressure, oxygen saturation. All normal. All unremarkable. All photographed in her memory. At night, she wrote careful notes on personal notepads at her kitchen table, her daughter asleep upstairs, the only sound the pen moving across paper. Dorsiflexion now 3 mm on the right, 5 on the left. Increasing sensation in the L3 or L5 dermatomes. Pain response appropriate. No signs of additional nerve damage. The movements were becoming less reflexive, more deliberate. Dylan was beginning to exert control over muscles that the official diagnosis had declared permanently paralyzed. She knew what this meant. Mercer knew too. That's why he'd locked her out of the official channels. Thursday morning, 3 minutes before her scheduled shift, James Garrett found her in the supply closet where she was counting sterile gauze packages. He moved his foot, James said. His voice carried the weight of a man reporting critical intelligence. On purpose. Full range. He knew he was doing it. That's good, Laura said without turning around. That means the neuromuscular pathways are firing. Synaptic connection is intact. Captain, what you're doing? I'm checking supplies, she said quietly. She turned to face him, her expression neutral, professional. You should go sit with your son. I'll be in his room at 3 o'clock to check his vitals. That's the time I'm scheduled. James understood again. He was a SEAL, he knew operational security, compartmentalization, the value of not knowing more than was necessary to know. But something in his eyes had shifted. A recognition not just of who she was, but of what she was still willing to sacrifice. Laura pushed past him into the hallway, where Dr. Mercer was already watching, already calculating, already planning the next move in a game he didn't yet understand he was losing. Tuesday morning. 10:47 a.m. Dylan Garrett was supposed to be doing passive range of motion exercises in the physical therapy room on Cedar Creek Medical's 4th floor, routine work, the kind that happens every day, the kind nobody watches too carefully. Laura had designed the protocol herself over 3 weeks of stolen sessions, subtle progressions that pushed his nervous system just far enough without triggering the protective shutdown responses his injury had programmed into his spine. The movements were delicate. Precise. Calculated to awaken dormant neural pathways that 15 doctors had declared dead beyond recovery. The physical therapist on duty that morning was a contract employee named Rodriguez, competent but cautious, the type who followed protocols without question and never looked for the miracles hiding inside the margins. Laura wasn't in the room. She was 2 floors down, charting vitals for Mrs. Chen in the cardiac step-down unit, when the overhead intercom crackled to life with a voice that made her hands freeze mid-keystroke. Code Blue. PT Room. 4th floor. Code Blue, PT Room, 4th floor. The words didn't register as real at first. Then her body moved before her mind caught up, 7 years of civilian nursing erased in the space of a heartbeat. She was up. Moving. The hallway tilted and realigned with surgical clarity. Her legs carried her toward the stairwell while her brain catalogued possibilities: stroke, aneurysm, arrhythmia, seizure. But Dylan had no history. No risk factors. No warning signs on this morning's rounds. The stairwell door hit her palm hard. She took the steps 3 at a time, her body remembering the cadence from a different lifetime, a combat medic running toward the sound of incoming fire, except this fire was happening inside a 10-year-old boy's chest. Her boots echoed like gunshots on the concrete. 1, 2, 3, 4. Muscle memory had a way of refusing to retire, no matter what new identity the Pentagon issued. No matter how many years you tried to be someone else. PT Room for B was chaos when she arrived. Rodriguez was standing frozen, phone in one hand, useless. Dylan lay on the therapy mat, his small body rigid, his face the color of old concrete. The monitor beside his treatment table screamed its terrible song, a rhythm that wasn't rhythm at all, just electrical noise where a heartbeat should be. VFib. Ventricular fibrillation. The heart not beating, just quivering like a terrified animal, blood pooling instead of pumping. His oxygen saturation had cratered to 64%. His lips were already taking on the grey-blue tint of hypoxia. The code team was 5 minutes out, minimum. Laura could hear the siren starting on the floors above and below, other staff mobilizing toward other emergencies. Nobody was coming to Dylan. Not in time. She didn't think. Thinking was for people with time. Her hand was already moving toward the crash cart, fingers finding the scalpel before conscious decision had even formed. The weight of it was familiar in a way nothing else at Cedar Creek could ever be, the balance point between the blade and the handle, the surgical steel cold against her palm, just like the knife that had been strapped to her thigh in a Fallujah basement when she'd made the choice to cut instead of wait. "Everyone back," she said. Not a request. A command. Her voice had changed. The careful nursing register, the deferential tone she'd cultivated for 3 years of civilian life, it was gone. What came out was the voice of someone who'd given orders in languages most people didn't speak, under conditions most people couldn't imagine. The residents who'd been gathering at the door, the 2 nursing assistants, even Rodriguez, they moved. Not questioning. Just obeying the authority encoded in 7 syllables. The blade went in at the 5th intercostal space, left mid-axillary line. She moved with the terrifying fluid precision of muscle memory, her hand steady as surgical lasers, skin parting without resistance. Blood. Warm. She didn't flinch. 2 ribs back, then through the pericardium, the membrane surrounding his heart. The sound was a wet whisper. There. His heart lay in front of her, grey and still and about the size of a child's fist. 18 gauge in his femoral, she barked to the nearest resident, a trembling woman whose name tag read Dr. Patel. Push the epi. 1 milligram. Do it now. It wasn't a request. It was a command in a war zone, delivered with the certainty of someone who'd held a soldier's open chest cavity and willed them back to life on the strength of technique alone. Dr. Patel's hands moved. Found the femoral. Pushed the medication. The syringe clicked empty. Laura's fingers wrapped around Dylan's ventricle. His myocardium was cool and still and absolutely unresponsive. She began the massage, gentle but firm, her other hand supporting the left atrium, the movement like kneading bread except bread didn't have a future depending on how well you compressed it. 30 compressions at a rate of 120 beats per minute. Her other hand was already reaching for suction. Someone had finally managed to breathe. The room was holding itself in suspended silence, everyone watching her, everyone knowing they were witnessing something beyond their institutional framework. "Someone give me a line. 14 gauge. Her voice wasn't loud. It was just completely, utterly inevitable. O2 sat. 72. Dr. Patel's voice was very small. Climbing. Not a question. The epinephrine was in his bloodstream now. His coronary arteries would be dilating. His heart was receiving the chemical push, the pharmaceutical artillery strike that might restart electrical activity if the manual stimulation didn't first. 60 more compressions. Her hands moved with the confidence of someone who'd done this in the dark, in the rain, in a combat hospital tent with nothing but a headlamp and training and the absolute refusal to let someone's child grow up without a father. Dylan's heart fluttered. Not a beat. Not yet. But the flutter of muscle beginning to respond, like a light switch flickering between off and almost. Again, Laura said. Another epi. 1 milligram. The syringe. The push. 75 more compressions, the rhythm automatic, the counting happening in a place inside her that had never really left Baghdad. 30. 40. 50. Her hands were inside a child's chest cavity and the world had somehow turned sideways because this wasn't supposed to happen. Dylan's father was a SEAL, which meant Dylan was supposed to live. This was supposed to end with Dylan's toes moving and his spine remembering how to carry signal and his father saluting in gratitude. Not this. Not this sudden betrayal of the body where a blood clot, probably loosened by one of her therapeutic movements, the thought would haunt her forever, had dislodged and traveled and stopped his heart dead. But that wasn't what mattered now. Now was the rhythm beginning to stabilize. Now was the O2 sat climbing to 81. Now was Dylan's chest cavity and the responsibility written in her own hands and the knowledge that she'd cut open a child without anesthesia or formal authorization and the code team was 1 minute away. 90 seconds. That was how long Laura's hands held Dylan's heart in the space between life and whatever came after. 90 seconds of compressions and will and muscle memory, her voice giving orders that every resident in the room obeyed because her certainty had weight and her competence was visible and her hands, scarred hands, combat hands, hands that had held lives together in impossible circumstances, were steady as stone. The door burst open. The code team flooded in. A resident physician she didn't recognize, 2 nurses, someone with a defibrillator. They stopped. Actually stopped. Their eyes went to her hands, to Dylan's open chest, to the surgical precision of an unauthorized thoracotomy performed by a civilian nurse in a physical therapy room. His responding, Laura said calmly, not looking at them. 2 rounds epi. O2 sat climbing. I've got an organized rhythm forming. She didn't move her hands. Not until the attending physician nodded and stepped forward and took over the manual massage, his movements clumsy by comparison, his technique adequate but nothing more. Laura stepped back slowly, deliberately, letting her hands fall to her sides. Blood dripped onto the floor in a pattern like red punctuation marks on white tile. Her scrubs were red to the elbows. Get him to OR, someone said. Now. They moved him. Transferred him to a stretcher, maintained her line, rushed him toward the elevator. Laura stood in the empty PT room, her hands burning with adrenaline and the knowledge of what she'd just done. Unauthorized procedure. Unrepresentative credentials. Saved a child's life using techniques that no civilian nurse should have possessed knowledge of. By the time the cleaning crew arrived to decontaminate the room and wash away the blood, Dr. Mercer was already making phone calls. Within 1 hour of the emergency thoracotomy, Dr. Marcus Mercer sat in his office with his door closed and his phone pressed to his ear. The fluorescent lights above him cast everything in a sickly pale glow. He'd already made 3 calls. The first was to Harold Bancroft, a board member whose daughter had been arrested for cocaine possession 2 years ago, an arrest that Mercer had quietly suggested be handled by a sympathetic judge. Bancroft answered on the first ring. The second call went to Patricia Chow, another board member whose malpractice insurance crisis Mercer had helped navigate through a connection at his country club. She listened without interrupting. The third call was to the hospital attorney, David Sterling, who had been waiting for an excuse like this one, a nurse who'd overstepped, a liability waiting to be weaponized, a career waiting to be dismantled. By 7 p.m., the machinery was already moving. Mercer had walked past the PT room where Laura had performed the thoracotomy and seen the blood cleaned away, the floor restored to clinical sterility. But the damage, in his mind, wasn't to the floor. It was what she'd done without permission, without credentials, without the medical license that separated people like him from people like her. His hands had trembled as he made those calls, but not with fear. With rage. With the fury of a man who'd spent his entire career protecting hierarchy and watching someone breach it. By 8 p.m., Mercer had filed an emergency competence complaint with the Colorado State Board of Nursing. The language was clinical, precise, devastating. Unauthorized surgical intervention. Scope of practice violation. Patient endangerment through reckless procedures. He'd written it with the care of a man who was building a case, not just filing a complaint. He'd attached photographs of the blood-soaked PT room, written statements from 3 residents who'd been present, statements he'd coached into existence with leading questions and careful wording. The complaint made the thoracotomy sound less like an act of surgical heroism and more like a crime. The hospital attorney, Sterling, arrived at 8:08 p.m. with his briefcase and his predatory smile. He was a man built from money and connections, the kind of attorney who destroyed smaller careers before breakfast. He spent 2 hours documenting Laura's actions, interviewing the residents, photographing everything, building what he called the liability picture. He used phrases like criminal negligence, unlicensed practice of medicine, reckless endangerment of a pediatric patient. He turned a surgical miracle into a scandal. His voice was smooth as oil as he explained to the residents that what they'd witnessed wasn't heroism, it was a crime scene. A lawsuit waiting to happen. A career ending in real time. By 10 p.m., Laura's hospital badge had been confiscated by hospital security. The plastic card with her photograph, smiling, credentialed, legitimate, was placed into an evidence bag. She'd been told to surrender her access codes, her login credentials, her parking pass. The message was implicit and absolute: you no longer exist here. She'd been escorted from Dylan's room while the boy slept, unaware that the woman who'd saved his life was being systematically erased from the building. At 11 p.m., hospital security arrived at Laura's locker with a warrant and a supervisor. They photographed everything. Her spare scrubs. Her trauma shears with her initials scratched into the metal. A worn copy of Advanced Cardiac Life Support Certification. They opened her jacket, the blue jacket with the unit patch sewn into the lining, and photographed it without understanding what they were looking at. To them, it was just a faded piece of fabric. To anyone who knew, it was proof of a life that no longer officially existed. They documented her personal belongings as if they were evidence in a criminal investigation. They treated her locker like a crime scene. At midnight, Mercer stood in the hallway outside the locker room, speaking to anyone who would listen. His voice carried the practiced disappointment of a man who'd been betrayed. "I always knew she was dangerous," he said to a cluster of night shift nurses who'd gathered, drawn by the commotion. "Too much instinct, not enough training. Too confident in her own judgment. I've seen this before. Overreach. Delusion. The kind of nurse who thinks she's a doctor." He spoke with the authority of a man who'd been proven right, who'd seen his worst fears validated. The nurses listened, unsure whether they were hearing truth or propaganda, unable to separate Mercer's assessment from the fact that a child's heart had stopped and a nurse had restarted it. Uncertainty was a weapon, and Mercer wielded it expertly. "She'll be gone by morning," he said. "Suspended pending investigation. And when the board gets through with her, she'll never work in healthcare again." At 2 a.m., Laura drove home in silence. The streets of Denver were empty, the city compressed into rain and darkness. Her hands gripped the steering wheel so tightly that her knuckles went white, but she didn't cry. She didn't scream. She didn't pull over to the side of the road and fall apart. Instead, she drove with the mechanical precision of someone executing a mission, turn after turn, mile after mile, carrying the weight of invisibility that she'd carried for 13 years. All the classified service. All the field surgeries performed under enemy fire. All the lives saved in the dark. Erased. All the years since, the 3 years of rebuilding as a civilian nurse, the careful establishment of a normal life, the deliberate forgetting of Captain Laura Bennett. Shattered. She parked in her driveway at 2:34 a.m. The house was dark. Her daughter was asleep upstairs. The kitchen was empty and cold. Laura sat at the table without turning on the lights. Her shoulders began to shake. Not from fear. From the weight of 13 years of silence, 3 years of reconstruction, and tonight when it had all collapsed in a single moment of compassion. She'd saved a child's life and destroyed her own cover. She'd done exactly what a Navy SEAL is trained to do, complete the mission. Protect the vulnerable. Make the hard choice. And it had cost her everything. Again. Her daughter found her there at 2:33 p.m. the next day. School had been dismissed early. The girl, 9 years old, with her mother's dark eyes and her father's stubborn chin, stood in the doorway of the kitchen and saw a woman she didn't recognize. Her mother, but different. Broken in a way that breakfast and homework hadn't prepared her for. "Mommy, why are you home?" the girl asked, her voice small and confused. "You work today." The question hung in the air like a weight. Laura lifted her head, and for a moment, she couldn't find her voice. The trained military composure that she'd worn like armor for 2 decades cracked. Her daughter saw her hands trembling, really trembling, the kind of trembling that came from carrying too much weight for too long, and the girl's face went pale. "I'm not working anymore, sweetheart," Laura said softly, and she pulled her daughter close. The girl didn't understand. She didn't know that her mother had been a captain, a legend, a ghost walking through the civilian world. She didn't know that the faded patch in the jacket lining was proof of a life that the Pentagon had ordered erased. She just knew that her mother was home at 2:44 p.m. on a school day, holding her like she might lose her, and something about the world had shifted. Outside, rain hammered the roof like applause or judgment or both. Laura's phone sat silent on the table, no calls from the hospital, no messages from James Garrett, no signal from the Pentagon. Just silence and rain and a daughter who didn't know that the person holding her was about to be vindicated by the same people who'd buried her a decade ago. The machinery that had erased Captain Laura Bennett was about to reverse direction. But first, there was only the dark house, the rain, and the weight of waiting to see who would come looking for her when the truth was finally revealed. Like this video if you support our troops. And if you or someone you love has served, let us know in the comments, we'd be honored to hear from you. Subscribe and let's get back to the story.